Hello everyone, I'm Kote. Today I will tell you 4 stories about Echinacea. Echinacea is a well-known plant in traditional medicine, but in evidence-based medicines it has several important studies. For example, there is meta-analysis and according to it, Echinacea reduces risk of upper respiratory tract infections such as common cold, flu, and other respiratory tract infections. And this reduction of risk is important. It's 35% and it's quite high reduction of risk. Also, Echinacea decreases risk of pneumonia. Pneumonia is common complication of upper respiratory tract infections. So it can decrease such risks of pneumonia by 50%. It's also important reduction. And now let's discuss how Echinacea doing this and what is the mechanism of action. Echinacea contains several important components. Let's start with first. It's alkylamides. Alkylamides are fatty acids, and when alkylamides are presented in blood, it induces production of cytokines. These cytokines binds to immune cells such as NK cells, macrophages, or B and T lymphocytes, and they activate these immune cells. And these immune cells attack infectious agents such as bacteria and viruses. Its first mechanism. So alkylamides is important because it increases level of cytokines. Second important component is caffeic acid. Caffeic acid have antioxidant ability. It means it binds and neutralizes free radicals. Free radicals, if alone, it can damage ordinal DNA and it can damage normal cell DNA and eventually it causes damage of cell and eventually it increases risk of chronic diseases and cancer. And when caffeic acid is presented, it binds these free radicals and neutralizes these free radicals. So it decreases risk of many chronic diseases and potential can have benefit on cancers. Third mechanism how Echinacea is working is arabinogalactans. Arabinogalactans are polysaccharides. Actually, Echinacea contains several polysaccharides, but most important is arabinogalactans. Arabinogalactans also works on cytokines, and it increases level of cytokines, and especially its effect is important on NK cells. And NK cells or natural killer cells are important because they attack infections and they also attack cancer cells. That's why it's important that Echinacea contains arabinogalactans. Arabinogalactans induces cytokines. These cytokines activate NK cells, and NK cells attack viruses, bacteria, and also attacks cancer cells. It's very important. So to summarize its mechanism of action, Echinacea have several components. First is alkylamides. Alkylamides activate cytokines and they activate immune cells. Second is caffeic acid. Caffeic acid is strong antioxidant and it neutralizes free radicals. And third is polysaccharides like arabinogalactans. Arabinogalactans increases level of cytokines again, and it activates NK cells. It activates also other immune cells, not only NK. It activates macrophages and B and T lymphocytes also. And now let's discuss what is potential health benefits of Echinacea. We already know that Echinacea is effective, and we have many studies about its effectiveness on common cold, flu, and pneumonia. But let's discuss what is other diseases in which Echinacea have some degree of effectiveness. Echinacea can be used as against respiratory infections. We already said about it. Second, Echinacea supports immune system. It can be used as immunomodulator or immunostimulant. Echinacea have anti-inflammatory action. It means Echinacea can reduce risk of many chronic diseases which are caused by chronic inflammation. Fourth, Echinacea's topical application, it means local application, for example on the skin, can have some degree of effectiveness on eczema, acne, and other skin diseases. And Echinacea in traditional medicine is used as pain reliever. So here is important point. Here is immune support, immune system support. Yes, actually Echinacea supports immune system to activate immune system, and immune system more effectively fights infectious agents and cancers and potentially other diseases also. But it's important to note that long-term intake of Echinacea can lead to immunosuppression. It's Echinacea's potential adverse effect. It can suppress immune function in long term. Second important adverse effect can be liver toxicity. Here's limited information, and generally Echinacea is considered safe, but according to some studies it can have some connection to liver toxicity, especially when intake of Echinacea is long term. And Echinacea can interact with immunosuppressants, for example cyclosporin. And cyclosporin is used in case of organ transplant, and it prevents organ rejection. And intaking Echinacea can interact this drug and reduce its effectiveness. So we should be careful at this case. And what is standard dosage? Standard dosage of Echinacea is 300 to 500 milligrams and 2 or 3 times per day. It's standard dosage, but specific dosage will define by doctors. Let's review now what we already talked. Echinacea have many potential health benefits, but most important is common cold and pneumonia. Echinacea contains alkylamides, caffeic acid, and arabinogalactans, and Echinacea improves immune system function by increases cytokines level, and they activate immune cells. Caffeic acid is strong antioxidant, and it neutralizes free radicals. Arabinogalactans also increases level of cytokines, and they activate NK cells and other immune system cells. Also, Echinacea have anti-inflammatory and antioxidant effect. It is used to support immune system, to reduce inflammation in the body. It can have positive effect on skin disorders such as eczema and acne, and as a pain reliever. Most important adverse effects of Echinacea is liver toxicity, and if person undergoes any immunosuppression therapy, Echinacea is not recommended because it can interact such drugs. And Echinacea can suppress immune system function in long-term use. It's also important. Thank you for your interest. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.